The development of the COVID-19 vaccine is one of the most important and exciting developments in global health in recent history. What's also exciting are key lessons learned from the national rollout of the vaccine and how this new knowledge gives us hope for a future of better health for all. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederle with AHA Communications. In this episode, Dr. John Varbaro, Chief Medical Officer at Bergen Newbridge Medical Center in New Jersey, joins Kathy Cummings, Director of Communications at AHA, to reflect on key strategies and action steps that prove successful in getting shots into arms and overcoming barriers such as access, trust, and misinformation. John and Kathy discuss the lessons learned that are moving healthcare forward.
John, thank you for joining me today. We know that the COVID-19 pandemic became a race for a vaccine and mass distribution, which had been uncharted territory in healthcare. The development of the original vaccine, with its anticipated and unanticipated obstacles to get shots into arms, became these critical turning points. Tell us about the challenges you faced during those early days.
First, thank you for having me. It was an interesting time, I will say. In the early days, we were also waiting day by day for updates. So that was probably the biggest thing that was a challenge because we knew that the vaccines were coming. We've been following the literature. As you pointed out, this was a pace that I don't think we had ever seen in science before. It's actually one of the great scientific accomplishments of humankind, really, to have created such a powerful vaccine in such a short period of time. If you look at the history, I think it typically had taken 3 years at the minimum. And this was, a year. But we were literally waiting day by day for updates. We were getting information on what the doses were, how we had to store them, when we were getting the vaccines. There was a lot of confusion around how many we were going to get, who was going to be giving them to us, because first it was going to be from the federal government, then it became the state, then it became how is the state going to get it to us. And then the other big thing that was interesting was we didn't quite know at the beginning how the data entry was going to go. And that might sound kind of pedestrian, but it's actually very important because we needed to be able to document who had gotten the vaccines, not just for our hospital records. Anything you do in a hospital, obviously, you need a record of, but also for all of the public health reporting measures. So in the beginning, going way back, initially they had told us the federal government would have a national system. That never happened. Then it became that the state would be creating a scheduling system and that we should hold off on creating our own scheduling system until they gave us theirs. And that's the state of New Jersey. And a couple of days beforehand, they told us, no, that's off. So we had to rush to create a registration system for all of these vaccines. Now, we here have an area we call the Annex. It was an area that was built actually during the height of COVID here in Bergen County, New Jersey. I think people forget that Bergen County got hit at the same time New York City did and got hit almost as hard. So during that, we actually, the Army Corps of Engineers came in and within about a week or two built us an extra unit of 100 beds. So we used that during that initial push, but then we had this extra clinical area. So we converted that into a vaccination center, and that we call that the Annex. And so we were figuring out the operations, how we were going to get people in and out, how we were going to register them, how we were going to do all that quickly, while our IAT people were rushing to create a registration system in days for this onslaught of people. And that created its challenges in and of itself because people were so desperate in those early days. It's now we think about all the people who have vaccine hesitancy. But if you remember at the beginning, there were people who were climbing over each other to get in and get a shot. And there was a lot of questions of manipulating who was getting it. And there were also these questions of who was going to qualify. They had the different categories and every state had their own rules for who fell into which categories. So at the beginning, we kept getting hacked. That was actually one of our bigger issues was people, and I understand where they were coming from, but we'd have days where suddenly a whole bunch of people were showing up who had printed out registrations, but weren't in our system. And it's because people had end arounded the system and then had sent it out to their friends and relatives. So you couldn't even go back to when it had happened because people were spreading it. And so we had literally, I think one day, almost twice as many people as we had originally planned to do show up. You don't want to turn them away because you want to get the vaccines into people. But that was quite interesting because we had to, on the fly, basically rush to put everything together and get more vaccines prepared and defrosted and set up and also at the beginning we were working out the procedures because there's also the time you had to watch people after the shot, especially again at the beginning. So all of that flow of patients, all that patient flow we're used to in running hospitals was like a microcosm of it, but times a billion.
So it sounds like, all that uncertainty, you had a lot of different teams, a lot of different moving parts, a lot of people touching this. How did you manage it all?
You have to be flexible when you do these things. We did have one piece of luck in that, we're the county facility, and the county also was getting some vaccines. They were set up to do it. And so we partnered with them to do it together. I wasn't at the time, but I'm now the chief medical advisor to the county. So I oversee the public health measures for Bergen County as well. And that actually partnership ended up being a little helpful because it gave us some more hands on deck. At the same time, again, when the volume doubles and you're still working out the process, it really had to just be, we couldn't be too precious about anything. It had to be, this is how we were going to do it. And 30 minutes later, we might be throwing out the entire plan and changing it on the fly. And so you need to have a team who's ready for that. And I think we did a good job of preparing people that might happen. And so when it did, it wasn't totally shocking. And, I think it helped that we had a bunch of people working on it who had been used to doing, well, not a massive vaccination effort, but used to being kind of frontline providers. I'm a hospitalist by training, and I came from the early days of the hospitalist movement. So there was always a lot of like inventing on the fly, especially in the hospital when a patient was crashing. So I was very used to that. Our chief nursing officer had a lot of clinical experience as well. So it was, I think, easier for us because we had been doing it our whole careers. Obviously, it's a bigger scale, but the principles are the same.
I've been talking to a lot of healthcare professionals throughout this pandemic. And what I consistently hear is the power of partnerships inside the four walls of the hospitals and health systems, and certainly, and equally important, the partnerships outside those four walls, the community partnerships, the public health partnerships. Tell me about the role that those different partners played.
It was crucial. Also, there's always the thing when you have partnerships of everybody's got their own different cultures. So you had to work through the cultural setups and also the differences in how they were used to doing things. But again, having the county just has different resources than a hospital does, right? When in hospitals, we run pretty tight, especially in a safety net hospital like ours. We don't spend a lot of money to have extra capacity in case of the emergency, right? Like even in the hospital, like we stock with some wiggle room, but we don't like way overstock materials, right? That was one of the issues at the beginning with masks and that kind of stuff. But the government is set up there to have that kind of safety valve. So the fact that we had a resource where the county could pull in extra nurses and extra providers pretty quickly was invaluable. And also just having extra thoughts. The other thing that comes out of partnerships is that you have people with different perspectives. And, it's one of the recurring things I've learned throughout my career is the biggest thing that hurts you is when you make a mistake. And the best way to avoid a mistake is to have a bunch of people who see things from different angles at the beginning because you can anticipate more things. And so that was a key part. The other key part was we made a lot of partnerships outside of our county partnership with different communities. We did a lot of work on health equity. Again, we're a safety net hospital. And so we partnered with leaders in a lot of different communities in our area, along racial lines, religious lines, sexual orientation line, LGBTQ lines, pretty much anything you can think of. We partnered with people in different groups in order to be able to get our vaccines distributed equitably, which I think we actually had some of the better numbers around in Bergen County. I think it was because of those partnerships.
When you talk about, as you enter into new partnerships, there are a lot of different perspectives, a lot of different experiences and skill sets that are brought to the table. So, how has this pandemic taught healthcare leaders like you to become good listeners?
You know, it's funny that you say that. One question I've gotten a lot over the last couple of years is, how did you guys do all of this stuff? And my stock answer is empathy. I think that it's really, really important. And I think if people didn't know that before, I think a lot of people learned that. Because again, when everything's when the sky is falling, or when you're in the foxhole, all you have is each other. And so, there's no room for ego, and there's no room for my way or else. It has to be like hearing everybody, and also understanding what people are experiencing, because otherwise you don't know how to speak with them, and you need to get through to people quickly. So it really is a lot of listening. I mean, I think that's key, not just in a time like the pandemic, but I think it is always, and I think it always has been. I'm lucky in that that was always part of my natural style, but I think that it's gotten emphasized just how important listening is. And not just listening to the words, but listening to what's underneath them, and the body language and all of that.
Yeah, no, that's great advice. I know too, when we talked before, you told me a little bit about a new Vax equity program that you
Mhm,
helped form.
mhm.
Explain what it is and how it works and some of the key outcomes you've achieved so far.
Yeah, so we did a lot on the vaccine equity front. We, as I started mentioning before, we partnered with a lot of different communities. We partnered with the Council of Black Churches here in Bergen County. We went to, there's an indigenous people nation here in our area, who we were, I think, the first people to go to them, I think, in decades. And we put together a mobile team. We drove out to them and brought everything to them. We did the same thing with all of the other communities. And I think, again, it comes back to empathy. You have to meet people where they are, and you have to be able to answer their questions, because everybody's got questions, and it's not wrong to have questions or be scared when everything's new. You have to come to them and explain it to them on their terms, right? So that's the other piece. You have to be able to pivot. You might have your stock answer you're going to give, and you realize that it's not getting through to people, because again, they have a different perspective, and you just got to find the other way. So the program was really, it was not one overall program, it was a bunch of little programs for every community. I mentioned we had an LGBTQ community program, we had a Latinx program, we had an Asian American community program. Pretty much any program you can think of, we did. And we, depending on the group, we either brought it to them, or some groups wanted to actually come to us. That was more comfortable for them. So we would make special times for those groups. Again, you come to people where they are. I think Bergen County, I don't have the numbers, but I'm pretty sure that we, especially remember early, there was all of these disparities in use of the vaccine amongst different groups. I'm pretty sure that Bergen County was pretty equitable almost from the beginning. And I think, or if not right at the beginning, pretty quickly. And I think it was because we did all of these partnerships and all of these equity groups.
I know the focus on health equity and making the vaccines accessible is going to, in the community partnerships, are going to be critically important as we are now entering into the back to school season, and
Mhm.
then around the corner is the holiday season. So tell me how you guys are preparing for that and keeping people safe during this ongoing pandemic.
I think, again, a lot of it's information. We're in a different phase now where people are a lot more lax about stuff. There's a lot more question. Unfortunately, there's been a lot of misinformation. So it's really trying to get through that and make people understand what is and isn't true, right? Because you also don't want to be alarmist or lie to people, because then you lose credibility, right? So, you want to make people understand what's serious, but also the level of seriousness to it, right? So we do a lot of education. We do a lot of question and answer groups still. We have a recurring series, actually, where of both podcasts and of a live video on a Facebook Live that we distribute, where I answer questions. And so we do pretty much everything. In terms of the school year, we've been remained open. We never closed down the center, but we've obviously cut back on the number of staff. At the beginning, we were vaccinating, over 1,000 people a day. We haven't been close to that number in a while, though every once in a while there's something that happens where it bumps up, right? When boosters first got approved, that bumped up. When different kids groups got approved, we got bumps there, but never to that initial number again. But again, you mentioned back to school. I think we intentionally adjust our staffing, and I think the next big thing we're anticipating are the next generation vaccines. I think that's where we'll see another push. When the targeted for the variant version comes out, and then the one I'm really looking forward to, but who knows what the time frame on it is the nasal vaccines. That'll help cut down on transmission. Drastically. But that one's way further out. The targeted for the variants one is already approved in some countries, so we're expecting that to happen at some point soon. And we expect that once that happens, we'll get another push of people. So we just staff for it.
Well, that's an interesting question too, is when we think about this vaccine technology and new shots coming, new variants coming, as well as, vaccines across a wide range of conditions, especially again for kids as they're going back to school. What are you guys doing about that kind of vaccine fatigue? How real is that? And what is the messaging around that?
It's a great question. Yeah, there is. And again, there's this feeling of people, where they feel like, oh, it didn't work. And you have to kind of remind them, like, no, that's how vaccines work. Like, you get a flu vaccine every year if you're somebody who qualifies to get a flu vaccine, because the flu changes every year, and this is it's not in the flu virus category, it's in the coronavirus category, but illnesses like that, they mutate pretty quickly. And so it's not uncommon. We're not fully at endemic stage where this would become like a seasonal thing, because I think once that happens, it'll become like the COVID shot will be like the flu shot. It'll be yearly and seasonal, and it'll be something people are used to. Right now, with it still evolving and still at a higher prevalence, it's not quite there yet, but it's trending there. And I think it's just reminding people of that, and reminding them that all medications have their pluses and minuses. What I tell people sometimes, a lot of people will say things like, oh, I knew this person, they got vaccinated and they got COVID, twice, or blah, blah, blah. And so it doesn't work. I'm like, no, you probably met people who had cancer, who died of cancer despite being on chemotherapy. You probably know people who were on heart disease medication who passed away of a heart attack. That doesn't mean the medication doesn't work. It just means it's not perfect. Unfortunately, we live in an imperfect world. And, with these vaccines, they're extraordinarily efficient at preventing death and serious illness. They had a good effect on preventing infection at the beginning. That's much, much decreased now. But again, once we switch to one more targeted for the variants, that'll kick back up again. Then, like I said, I think the nasal vaccine, whenever that comes, will be the real game changer on that as well for transmission and spread.
So we've kind of talked a little bit about the need for a lot of incredible collaborations and coordinations, and then still overcoming vaccine hesitancy among some populations, and then the vaccine fatigue. While there's still the possibility more boosters, more shots coming. What are some of the other challenges that still lie ahead?
It's another great question. Other challenges that are lying ahead, I think it's also the overlap with other things going on, right? We now have a second pandemic of monkeypox, obviously very different kind of pandemic, both in how it spreads and the populations it's in, and how lethal it is, and what the side effects of it are, and also different technologies for fighting it. There's this word about polio virus reemerging in New York City. So, we live close to New York City. So that's another one that we've been hearing about. So I think it's keeping people abreast of what's going on. Like I said, being honest with people, telling them what the actual risks and benefits of everything are, and keeping people aware of what they really should be doing and giving them good advice. Like I said, I think that's really the key. We try to do a lot of education. We do the best that we can. We use social media. We do traditional media. We do podcasts, obviously. We do pretty much anything we can to reach out to people. We do public events. We have the mobile team that still goes out into the community, does education events for people in different areas. we try pretty much anything to make sure that people are in the know.
So this pandemic has been about the expected, the unexpected, lots of lessons learned, lots of trial and error. If you were teaching a course on the pandemic,
Mhm.
what would you want your students most to know?
Oh, what would I want them most to know? I think it's part what I said earlier. You can never be too precious about your plans. I think that that's a lesson that you learn working in a hospital, particularly learn it during an emergency or something like the pandemic. Again, even going back before the vaccination program, we would spend hours making a plan, and 2 hours later it'd be in the garbage can. Like, it was just everything, especially again that early push, because again we were in the thick of it. It was literally 24/7, and you do what you have to do. Like, it was like you kind of threw everything on the table and figured out what worked. A friend of mine once made an analogy to the scene in that movie Apollo 13, where they kind of throw everything on the table and they say, like, "What? Okay, this is what we got. What can we do?" That was kind of what it was like. It was really just like, okay, we'll make it work. I always tell the story. At the very beginning, I did house visits. Our original testing program was literally me, the CMO, going to people's houses and examine, because everybody was afraid. Nobody would go. So I went myself. I used to bring a packet of PPE with me, and I would, because people's neighbors would freak out if they saw somebody coming in it. I would go into their backyards and I'd sneak into their houses and do a physical exam and swab them, and I had a bucket of ice with me to keep the samples good, and all crazy stuff. And then things just on the floor and in the hospital itself. And again, looking for partnerships here in Bergen County, aside from our partnerships on with the county and with the vaccines, in that early push, there's 4 other hospitals in the area, and we basically all banded together. We're normally competitors, but it was literally a like, okay, I have extra ventilators, you have some extra gowns. I'll drive over to you and we can swap them. And we were doing stuff. It was like, whatever works, we got to get through this together, because we're either going to survive together, or we're going to drown together. So we make it work.
Well, I love the analogy of Apollo 13 because it's something I think most all of us have seen, that
Mhm.
particular scene. And it really does capture the mood and that sense of urgency and that problem solving together. I mean, wow, you should bottle that. That was great. So let's kind of think about the future even more. What are you most excited about when it comes to vaccine technology for the future?
We touched on it a little earlier. This was really, as a science nerd, this was one of the most remarkable things I've ever seen. It really is. I don't think people really have comprehended yet, because we're still too close to it, what an incredible accomplishment this was. The mRNA technology is something that's really just remarkable, and the ability to make targeted ones for different variants. And actually, they should be able to do it relatively quickly. I think it's a game changer, because I think you can, you have now the knowledge that if something new arises, you can pretty much get something pretty safe together pretty quickly. And I think that that's just exciting, just seeing like where science has taken us. Like, I've been studying molecular biology back to college, almost over 30 years now. Like, just to see it actually in action, and then actually, a virus that came into existence in the world in the year 2019, and by the end of 2020, we had multiple working vaccines. By the end of 2021, we had not just multiple vaccines, but multiple therapeutic agents. That's incredible. That's never happened in humankind before. It really shows the power of people working together across the world, because it really was an international effort. The original concept for it, I think, came from somebody in Europe. There were scientists in China who sequenced the DNA. The scientists here who built the vaccine. It was just like, it was literally international effort, and it was pretty remarkable how the scientific community came together to do it. And I think that's really exciting, because it shows us that if we actually do work together and are honest with each other and aren't divisive and spreading misinformation, we could pretty much conquer anything. And that's a very cool thought to have.
It is because I feel like all this the great energy that I'm getting from you too. I mean, while this has been an overwhelmingly difficult time to be working in healthcare, to you, it feels like it's been a very exciting time
Mhm.
and worthwhile time, and you're so glad to be in healthcare right now. I mean, am I reading that
No, you're correct.
correctly?
You're correct. I mean, it's a mix, but I'm not saying it wasn't exhausting. I'm not saying there weren't days at the beginning. I say I stayed away from my family at the beginning when we didn't know what stuff was going on. That's hard. Like, I'm not saying it wasn't exhausting. I'm not saying it wasn't difficult. It was, but this is also what we do this for. And I guess it depends on why you went into this. I went into healthcare because I wanted to make a difference in the world, and I spent my whole career trying to make a difference, and then I guess I did, which is kind of crazy to think about. I still don't totally, that still hasn't totally set in, that we really did. We made a difference, and that's what we do this for.
Well, I think that's a beautiful way to end this discussion, but are there any final thoughts you want to share with your colleagues across the country?
Again, I think just keep doing what we're doing, keep being honest with people, keep coming to people where they are. I think those are the biggest pieces of advice I can give. And like I said, empathy, always important.
Well, I can't thank you enough for your time, for your insights, for your best practices. Really appreciate it and appreciate all that you're doing.
Thank you so much. It was a pleasure, and thank you for having me.